Hello and welcome to another edition of Heart of Healthcare. My name is Dr. Jan Bonhoeffer, and these podcasts are about helping physicians restore balance in their lives so we can co-create a medical system that benefits everyone. A quick reminder that you can find more information about our nonprofit heart-based medicine and the work we do to support healthcare professionals at heartbasedmedicine.org.
Hello and welcome to the Heart of Healthcare Podcast Series 2, Episode 4, when we're asking why it's vital to share patient stories to deepen the public's understanding of how the medical profession operates in the emergency wards.
Healthcare professionals are often finding themselves in a situation where our professional decision-making is biased. And from science, we really don't like bias. And in clinical care, we have to really quite often keep up with it. And the biases that we're facing are so often referred to as system biases or system problems, or it's because of the system. And we'd like to break this down today a little bit and look at what are those biases and where are those pressures. We're all aware of the economic requirements and of legal requirements that we have to live up to. And we are also aware of an increasing number of health outcome metrics that are all well intended, but sometimes may actually be in the way of giving the best medical treatment to the patient in front of us, to the individual patient. So today, allow me to introduce two really fantastic new guests who are extraordinarily well positioned to dive into this conversation with us. I'd like to really welcome Dr. Lou Anne Wellford, who has practiced emergency medicine for over 30 years. And early in her career, she served 8 years in the US Army. And over her decades in medicine, she has encountered many heartwarming and heart-wrenching stories. She has witnessed the physical, emotional, and financial impact of an illness or accidents on its victims. So welcome, Lou Anne.
Thank you for having us.
So we're also welcoming today Alex, her son.
Thanks for having us.
Yeah, thank you. Tell us about where you are in your medical career.
So I'm actually about to start my residency training over at a private hospital in New Orleans. I'm very excited to get started here in about a week or two, actually.
Fantastic. So we have kind of present medicine and the future of medicine with us today. And of course, as in the last episode, today we'll be joined by Dr. Dan Dinenberg, who is double board certified in family medicine and integrative holistic medicine. And so let's dive into this conversation. And Lou Anne, you have actually, besides your daily work, you have shared with us that you are writing a book, and this has come out of reflections on your vast experience. And this book is around one particular story. It's about one particular story that you have experienced. Would you like to share with us what that was?
Sure. I'd actually been interested in writing for a long time, but I could never figure out, what kind of story I wanted to tell. And a close friend of ours has just had her second heart transplant, 26 years apart. And her story is just fascinating. The relationships that came out of this heart transplant, she's had a 20-year relationship with her donor family. She fell in love with her cardiologist and married the doctor who saved her life when she had cardiac arrest. And the story just goes on from there. It's just amazing. So I really wanted to use that story, which is sort of a love story, to also give people a glimpse into the medical world and just see what someone goes through when they suffer a life-threatening or life-ending illness, and also to show not only the transplant recipient's story, but what's unusual is to also show the donor story in the same story. And so both of their stories are kind of told parallel.
This is very unique. This is a very unique story, and in the way that you've told me this story in a longer version in a previous call. I was really moved by how you have shared how this has changed your perspective on your profession.
Yeah, sometimes, I guess in every job you get guilty of getting caught up in the daily grind. And we have to remind ourselves sometimes that this is someone's life. It may be the routine for us, but they're terrified, or whatever is going on with them can affect their life or their family for a long time. And so I think it really brought me back into seeing through the patient's eyes, for one, and then just realizing that when people are acting a certain way or angry or whatever, you just don't know what's going on in their life that's bringing them to that point and that behavior or whatever it is. So I think it's just something we constantly have to remember.
Yeah. It is an interesting phenomenon that whenever a healthcare professional who's been working for a while actually is on the other side, so is in the patient's position, that this is really kind of an awakening moment. And it kind of really changes the way that we're practicing. Isn't that alarming?
I think it's human nature, but I think it does take, a step back every once in a while, either when you become a patient or have a procedure, and then you realize, oh, this is what it's like on the other side of things. I just think that you need these constant reminders.
Yeah. So maybe, Alex, maybe this is a question for you. When you went through medical school, and so you were kind of jaded to some degree. So now, how does this sound to you when you hear this? So you're now about to kind of go into this practice, and you're now about to, start your residency and be exposed to lots of stories and time pressures and legal pressures and economic pressures that you're not having a full idea of yet, but you started with a flame, right? There's this spark that actually got you into this profession. And do you already see that something happened between day one of your medical school and now that you're going into residency?
Have I noticed a decrease, is that what you're saying?
Or a change in what kind of change in how you see patients, or how you perceive yourself in the face of somebody who is needing your attention or is looking for your help?
Mm-hmm. So yeah, I definitely would say that there's kind of a somewhat of, not detachment, but compartmentalization of patients and the human aspect, and while trying to still remain compassionate, and also removing yourself in some ways so you don't have to deal with the emotional trauma of someone who just died in front of you, per se. I have noticed myself, I'd say, putting those, trying to put things into different boxes, I guess. Moving forward into residency, though, something I would like to be able to continue to do is bring, the same amount of compassion to each patient. As a medical student, you have a very small amount of patients, so you can give them your full undivided attention to make sure they are getting the best possible you have. In residency, though, your numbers get scaled up, and I'm hoping I can continue to bring that while increasing the amount of patients I see.
Yeah, beautiful. We can relate to that, I guess. So let's come back to this later and see what might it take for you to be able to manage this, kind of to really see that the intention that you have now becomes reality. Let's see what that takes. Just before we do this, I'd like to shift to Dan, because Dan, you've been through medical training, obviously, and through residency, and so you're like a step on from Alex now, and I wonder how you see this now. So basically, now, once having been through the training and then actually moving on from that to your private practice, what advice do you have for Alex? What helped you on the way?
Thanks, Jan. It's amazing to give perspective as we grow and experience, because I think that what Alex is speaking to is that best version of ourselves and how to maintain that and create that in a daily process. So, the difference between kind of medical school and training is the numbers, and the numbers have pressures to it. Whereas kind of what was described as the daily grind, the routine, as Lou Anne had kind of mentioned it. And I think where we're talking here, and I think Lou Anne giving that perspective on that story is how to see it through the patient's eyes. And so to show up in each and every patient encounter, knowing that for them, this is the moment that they're with the physician. This is a moment that is a really important, challenging, and a lot of times uncertain and maybe even scary moment for them. And so what you can do and the subtleties of how you do it. And so I would bring a deep awareness into who you are and spend a lot of time in sort of how you can show up, and how you show up for yourself ends up being how you show up for your patients in that way. And so, what we've discussed is a lot of, in training, there's this aspect of, trying so hard and pushing yourself. And at some point we realize that there's a release valve that needs to happen within that training. And so if you can create that ebb and flow as you progress and realize when you're getting under tons of pressure, and then what you need to do to release that for yourselves, and then to start to share that, Alex, with your patients. And then that way you kind of normalize the experience and you can really be there with them. In my own experience of that, I think that becomes incredibly important, because when you see something through your patient's eyes, I've actually come into a place where I would consider what I'm doing a lot more precision medicine, a lot more bespoke model. A lot of times it's challenging to even come up with what really is the medicine now, because I'm acting as really a physician guide. And that's what I consider myself. And so I really I reflect and put myself in the patient's, my understanding of what the patient is going through, to create these healing journeys that is really individualized to where they are and how to bring them into a place. And so what that requires is all of the skills of deep listening and presence and understanding and really empathizing. And when you do that, then you could bring someone into a more individualized precision understanding of where they can go. Now, that's exciting and that's amazing, but I'm sort of back into a model where I'm seeing less clients and spending an enormous amount of time. So I'm actually interested, not to take this back, but Lou Anne, what I heard is, the U.S. Army, and, in a really, as an emergency room physician, it's a really kind of a more intense environment. And so, it's wonderful to be able to play. And yes, I've evolved in my career to be able to do this. And I'm actually doing incredible medicine, what feels like incredible medicine. I'm actually curious, how do you bring what we're talking about now in that front line, in that intense pressured situation? Because that's ER, that's in the Army, that's right there. Is that something, if you don't mind speaking to, because I think that will illustrate what we're trying to do and how to do that as an ER physician, maybe in residency.
Yeah, well, like you said, I'm kind of the other extreme, is that we are in a time crunch and there's never an end to the flow of patients coming in the door, and we don't know, what's the next really serious one. And so it's very hard to juggle. I kind of have to listen to that patient at that time, but there are times where I have to excuse myself and say, I'm sorry, I got to go, I'll be back. And you hope people understand that. But yeah, it's a very hard thing to do. And my patients don't get a lot of the time. And so you have to make sure the time they get is the best that, you can give in those few minutes. It may be only 5 minutes, the entire encounter. But, I've learned there's frequently an agenda or something that the patient wants that they're not always verbalizing. And sometimes it's just they're afraid they're dying of cancer because their mom just got diagnosed with it or so. And so I've learned to ask, what can I do to help you, or why are you here, or is there something else that we're not addressing? Because otherwise there's frequently something left hanging and you didn't really solve what they came for.
I think you're describing the situation really well, where you're at the extreme end in medicine that is very standardized, very protocolized, very algorithmified, where there's sort of about the technical stuff is really is very algorithmically determined, so that an entire team can function like a single organism to do the right thing within a few minutes. So that's very unlikely. If everybody is kind of a creative artist, that's going to be really challenging to have 10 people around a person saving a life. If there isn't a shared understanding about a common path. And yet there are these individuals meeting in this compressed moment of time. And we do have the experiences that we do. And when we don't give them attention, then we become cynical. And then you get this kind of typical ER doctor cynicism, or the pathologist cynicism, or the different variations on the theme, where every branch within medicine has their own recognizable cynicism that we can almost tell by the jokes that somebody makes is what kind of profession, what kind of discipline they work in, right? So that's such a high price to pay. And while it may serve sort of as a painkiller at the moment, it starts to pile up. And I wonder what might be ways so that we could introduce so that Alex doesn't have to go through the same process. That he can actually kind of stand on our shoulders rather than have to, sip our soup, So what might it be? What were, Lou Anne, are there things in your history, in your experience, are there, if you like, take homes that you would like to give to your son?
Yeah.
Look, these are situations that I have seen, and I'd like you to be aware that this is, we're gradually, we're losing ground, and we're kind of being lured into some story, into some narrative that isn't really healthy. Are there kind of critical control points?
Yeah, I think there are, in general, like they say, it takes a village. I mean, medicine is a village too. And I think I've found, especially after a cardiac arrest or a death or a very stressful event in the emergency room, talking to my partners, and bouncing things off each other, and talking to the nurses and the debrief and just how did things go. I think that once we all realize we're all going through the same emotional feelings of what just happened, that it helps to talk to other people about it. So you're not alone. You're not an island going through this. Everybody's experiencing it. And then I think the other thing that every individual finds their way of dealing with it. But I guess that's where the writing came in for me, is I found it very cathartic to just things I had kept bottled up, or my experiences all these years, to actually just be able to put it down on paper and kind of channel it that way, I think helped a lot.
Yeah. And in the way that is there any kind of training? I'm just thinking about the psychiatric colleagues, right? There's like years of training in supervision and intervision and violent groups, and many would actually also look for coaching outside. And is there like formal training, or is there a way that you have learned, or that is there a kind of trained way in how you're sharing, how you're debriefing after a traumatic event, or how you're dealing with this? Or is this kind of freestyle and everybody does their best?
I think some hospitals probably have an organized debrief, but again, soon as we finish one thing, we have to move on to the next patient. There's 8 more patients waiting. And so I think it's freestyle. It's just mostly when you get the chance to actually sit down and talk about it, and it may even be days later when you just call up a colleague or a friend, it may not even be that same shift, but I just think it's important to talk about it and not keep it bottled in.
If you were to propose to your colleagues or in your company or to other, groups of emergency physicians that it was useful to make it part of our working hours to take care of ourselves, that self-care is really a basis, basically put on the oxygen mask for yourself before you stick the tube into the patient's throat, to say, so would you think that this would find resonance? What would happen? What responses would you expect from your colleagues?
So in what way? You mean like a formalized sitting and talking kind of?
Yeah, whatever it might be. If you're saying, well, let's establish ways that, if you were to say, I've experienced for myself that actually I didn't allow myself enough debriefing time and really integrating the experiences, and I didn't really take care of myself enough during this time, that I worked to serve others hours and hours and hours on end, one after the other, and I could kind of hardly take a breath myself in between. So is there a way to inspire others or could you see that it's part of that self-care practices, sharing in the group? How do you feel? What is it that you need? Are you taking care of yourself before you go and save lives? Do you think colleagues would embark on this, or do you think this would meet kind of resistance in terms of, I don't need this. I'm an emergency physician. I don't need self-care.
I think everybody probably just kind of learns on their own. I mean, there would be no one time where we could all sit and talk, because we have 5 doctors on at a time and we're staggered every 2 hours. So everybody's shifts are ending at different times. And but I think, over the years, people learn, I need to drink water during my shift, or I need to go have lunch, or actually take a bathroom break, because you can't go 12 hours, and without fluids. And I think a lot of us try to do that at the beginning, and you just have to learn that, you have to take a few minutes. Things aren't going to fall apart if you leave for 5 minutes and go get a drink of water or whatever it is.
Alex, was any of this included in your medical training so far? Did anybody talk about self-care and what you can do to kind of stay alive during your work time?
Yeah, so in medical school, they had a good amount of emphasis on self-care, and they kind of bunched it into our ethics class, and actually had a little bit of mindfulness training as well. Something I just did in my mindfulness training module for my new hospital, actually, something I saw that I thought was very interesting was basically taking like a long mindful breath before going into each patient room, and basically allowing that to, like, with that exhale, leave all the other patients you were just, seeing or worrying about, all the stuff you were dealing with at home, and exhaling that rest of that day, and just going in with the fresh new mind to give, like we were talking about earlier, your best self to that brand new patient. And they actually have been doing a pretty good job of including stuff like mindfulness into formalized medical training, which I've been really excited to see, actually.
Wow, that is very fortunate. I think you should probably broadcast that. It would be wonderful to have to include I'm not sure how the medical school is structured in Switzerland. It would be the Vice Dean for undergraduate studies. I'd be excited to talk to him and have a podcast here and hear from him why this was introduced at the medical school. I think this is just, so far, there's still a few medical schools worldwide that are actually doing this. So that's very, very pioneering and really exciting to hear. Dan, how is this for you? So you went through the classic, if you like, the conventional medical training, and then you added the functional medicine holistic training thereafter. if you were to compare these two trainings in terms of how much emphasis is given to self-care and the role of self-care in these two training syllabus, I guess, is there, what is it that you saw as a difference?
There's definitely a different emphasis. I think from the integrative holistic program is like from its inception, there was sort of a questionnaire sort of on mind, body, spirit, and really an awareness into your own inner workings. And so I think from a conventional approach, there's much less of a diving into your own. It's almost as if you yourself are kind of untouchable. You've gone through a period of time where you've become this, powerful entity that can take care of others, and that you yourself are not questioning your own kind of ability to do that. And so there's an aspect of that. I mean, to be fair, sort of like Alex is talking, I did, choose and find UCSF program up in Santa Rosa, which is known to be a much more holistic thought process within medicine, within, an understanding. So even from a conventional residency training, I feel like there was a much more patient-centered model. It's a community medicine program, and so, and it's known to be an underserved program, and so there's a lot of emphasis on taking care of the community at large. And so I think from there, even though the training wasn't inherently focused on it, when you're taking care of an underserved population and you're among colleagues that are there to get the best training that they possibly can by taking care of someone, I think that the holistic mindset kind of seeps into it. But it's different. It's different in sort of how those are set up. And I think for myself, that's where it becomes the bridge, where I end up bridging one to another and kind of show up for a patient and be able to do that. I love how Alex is kind of bringing that mindful breath, because ultimately, like inspiros, the word itself, and to inspire, to inhale is actually the inspiration that we're bringing. So, just as sharing that, it's like we inspire, we bring in that breath, and we are able to show up for another in that way, and that becomes extremely important. And I think that what we're really getting at here, because we are talking about different sides of the spectrum, like I've purposely created a way of supporting others which is outside of a clinic setting or an ER setting, where you have back-to-back and you have this sort of staggered approach. One thing that I'm really interested in is, Lou Anne is kind of mentioning, well, how would 5 physicians be there at the same time? That's just not how it's created. But because we have, the young moving into a field, is there a way to create that? Like, can we create an environment where that could exist, or are we just handed down, well, this is how we stagger in order to support? Like, that's where I'm excited about this conversation to move into, is like, is there an opportunity, is there a chance to create the breath, the inspiration, even within an emergency room setting where the physicians themselves are taken care of and they don't have to learn along the way? It's not like, I think Lou Anne kind of brought up the trial and error that we've all gone through, which is, hey, I tried to do a 12-hour shift without going to the bathroom, and it didn't work real well, or without drinking, or without, like, that's the experience of all of us of being alive. But now this is an opportunity. How do we create an environment which is actually serving in order to do that, in order to kind of move through?
Lou Anne, I guess from our previous conversation, it really struck me in how you said, yes, time pressure is one, but then the economic pressure is another, and the legal pressure is a third. And then on top of it, we have to deal with the health outcome metrics and kind of meet all of these requirements. And so basically our actions as healthcare professionals are driven by this horizon almost of requirements that are non-medical. And what would it take? What would it take for us, if you like, to reclaim our sovereignty as healthcare professionals in this very economically in this system that is driven by economic interests and by, let's say, legal fear, what might it take for us to reclaim our sovereignty, particularly in your situation? What are ways that you found work?
I have no idea. um, yeah, I mean, there are obviously the advocating groups through our medical professional groups. I kind of rely on that. Some of the people in my group are very involved in trying to legislate some of those changes. Texas is actually very friendly as far as physicians and lawsuits and things. So it is a healthier environment from the legal standpoint for us here, especially for emergency physicians. But as far as the outside rules and regulations and metrics, I don't know, except that, our professional organizations using data-driven medicine to say some of these things aren't appropriate or don't actually work, and kind of having them fight the battle, I guess. I don't know. It's very hard as an individual physician to make those changes.
Yeah, I guess part of it is kind of a top-down approach where we need, if you like, unions almost. I guess that's something that is not available in every country, and for physicians. And another aspect is like a culture change. And what I see now with the story that the very encouraging story that Alex is sharing is that actually there's a way that we can do this bottom up, where there's a next generation coming in that has actually learned about mindfulness from the get-go, and that has actually learned about kind of self-reflection in medical school already. And if you like, if healthcare professionals are acculturated in this kind of way, are coming to the starting line now, then there might be hope for a bottom-up culture change as well. So possibly we can, while we hope for the old foxes to represent as well in politics, we can just as well start pushing from underneath and see how this could work. Alex, I wonder, from your perspective, and it might be just a few weeks too early to ask you this question, as you but from your point of view, do you have a sense from what you want and from what your intentions are that you can actually keep up this inner spark, and that you can maintain this compassion that you naturally feel, and that you don't want to see this suffocated, and that therefore you're appreciating this fragmented but hey, precious training that you had on mindfulness? Do you see yourself, if you like, alone with this? Is this something you can talk about with your fellow students or with your fellow residents, those that are now moving into residency? Is this something you talk about, and how is it talked about?
Yeah, I feel like this is a pretty common or shared, I guess, and discussed topic. People now are like you were saying, now that it's been kind of a bottom-up approach, given this type of material to students from the beginning, it definitely sparks more of a conversation among students and young doctors that maybe in the past it might not have been the case as much. But keeping that spark alive is definitely something that we all have to think about, and especially with compassion fatigue and burnout. And kind of like Daniel was saying earlier, treating the patient looking at that from their perspective. And not just thinking, oh, there's another chest pain coming in the door. There's this person who's experiencing chest pain who has their own individual problems and life stressors and individual circumstances that may not be actually part of their physical condition. Like my mom was saying a minute ago, why today? What are we not addressing for you? Making sure we're looking at not just the numbers and the science behind it, but still keeping every day and every shift, what is this person in front of me need, and how can I get fulfill their needs the best possible?
It's really amazing. This is thank you for sharing this. This is very encouraging. I think this is a very exciting conversation, where we have kind of the emergency physicians on the one hand, and we have the bespoke health journey on the other hand. So where time is kind of one of the key kind of factors that we can play with or not play with. And then also between the two of you, we're looking at different generations from, experiencing the extremes and the environment of the army and the emergency room, where a lot used to be in a kind of, it's a military language, right? It's about fighting disease and winning the war against. And so it creates a narrative and a mindset that is very understandable, because that's a lot where medicine has come from. Being inundated with disease and being inundated with catastrophic events. And this has been the best way possible to handle this. And now you're seeing Alex is kind of representing a next generation where this starts to melt a little bit, and where there's an evolution that we can see coming up on the horizon that really feels good for those starting off. It feels like there's actually something that is nourishing coming my way. And there's something that I can hold on to as I'm kind of out there on the wild ocean, swimming by myself. So that's really exciting to have that conversation. Let me see, Dan, would you like to, do you have a closing comment?
Thank you, John. I do have a closing comment, because I see the juxtaposition that you're creating here, and I love between, the experience levels and the time. And I think I think ultimately it's like the Gandhi quote of being the change we want to see in the world. And the way that I see the future of what this is I think health metrics are going to drive this, because there is a financial modeling here. We can't just say that doesn't exist, because it does. But we could set up the emergency room physicians in a place where they're doing the best of what they're doing. If it's acute care, let them be heroes in the acute care model, and let them be able to kind of support them to do that. And then let's realize that the entirety of our care continuum is not necessarily that. So, there's plenty of people that slip into the emergency room that should be seen from a primary care. So as an integrative holistic family doc, I know there are people that are coming into the emergency room that shouldn't really be there. And so Lou Anne in her busy day is spending those 5 minutes because she realized that what they need, she needs to triage. And that's what she's learned in her Army training. That's like what ER is about. And so setting up a dynamic model where we're meeting the health metrics, so the financials are there, but everyone is actually doing what they do best, and in the time-centered approach for that. So I actually have hope when we hear kind of Alex entering in that with presence and mindfulness and inspiration. And I love that Lou Anne's kind of bringing in all of her experiences into writing, and that I'm able to do these bespoke healing journeys, because all of us then can play this authentic expression of who we are. And I think that is the future of a very healthy medical model.
Great final comment. Let me thank you for being on the show. This has been a really exciting episode. And I would I hope that everybody who's listened in and joined us during this season has enjoyed the chat with you. And if you're listening in, you can find more information at heartbasedmedicine.org. And I deeply appreciate if you could click subscribe on whatever platform you're listening to this podcast on. And I wish you all the best until the next time. And thanks for listening, and take care.
This has been a Heart-Based Medicine production. Thanks for listening.